Good morning, Mr. Rafiqul Islam. Welcome to Chennai, India. Tell me about yourself.
Thank you, sir. I had an accident last 3 months back in my city. From motorbike, I just fall down and have some injury. At that time, I went my doctor, in my local doctor. He found that there is a torn or some damage of ACL, something like this. Then had an MRI. I found there is a partial tear, something like this. But after that, I consult with another doctor. Finally, I talked with my one uncle, like my friend. So I talked to him as because of he came here in Chennai last 15 years back, and met with this Dr. A.K. Venkatachalam, and had an reconstruction of ACL and ligament or something. So I little bit inspired of this. Then I come immediately take decision and come here. Now I am in Chennai. I met with doctor, consult with him. Last 2-3 session I consulted with him. Then he suggests me to go to take a 3 Tesla machine MRI. I went to Westminster and got MRI report in details. Then I show him and he explained to me in a line by line, which is very much psychologically comfortable for me. Then he explained to me what is needed for this situation, what is going to be do, or what need to be do. Then after that, he given me some time to think about this, and then finally I decided to. I found that there is a when I got the report from MRI, then I found there is a ACL, completely ACL is torn, and the problem is meniscus. Some of portion middle and lateral meniscus also torn. So he suggested me to remove this torn area, and also he suggests me as because of we found in the report there is a arthritis problem, which is little bit badly already involved or with my bone and everything. Cartilage. So cartilage already 50%, more than 50% of cartilage, which is already gone as per report of MRI.
3 Tesla MRI.
3 Tesla MRI. When we found this one, he suggests me to go for a stem.
No, firstly, arthroscopy.
For the arthroscopy, yes.
Keyhole surgery.
Keyhole surgery for the
to remove the torn menisci.
Torn menisci, middle and lateral, and after that, he is going to be stem cell therapy. What is called this upgrade therapy, to take out my fat and blood and dilute and then make a paste and then push it to by inject to my bone joint. So I think this is very update technology, and it will be work hopefully in my knee joint. And so tomorrow morning hopefully I will have a good surgery by Dr. A.K. Venkatachalam, and I am psychologically prepared to do this operation, do this surgery without any hassle. I think hopefully everything will be fine like this.
So hopefully by tomorrow at this time the surgery would have been over.
Right at this moment, yes. He suggests me to come early in the morning as because of
5 o'clock.
5 o'clock. This early in the morning is in generally early in the morning. His doctor's brain is cool-minded, and he suggested me at that time. He is very much comfortable to do any surgery. So anyway, I come 3:30, 4 o'clock early in the morning. I took to come here and then do the operation, do the surgery.
So by this time, hopefully you should be all right, and we will again discuss your condition tomorrow afternoon at this time, around this time. because you'll be away from the theatre, outside the theatre, and you'll be recuperating. So we will meet again and record your condition tomorrow also.
Of course,
And
of
then
course.
you can tell us and everybody how you're feeling after the procedure.
Yes, yes.
You will be, it is a daycare procedure, that is, you will be coming in the morning and you will be going out in the, walking out in normally by afternoon or evening. You can go and
With a single crutch.
with a single crutch.
That is my allergy, double crutch.
And then you can do physiotherapy. We will teach you physiotherapy
Okay,
here.
okay.
And also in Bangladesh, as per our advice, and you will recover. So slowly,
Hopefully. Inshallah, inshallah.
everything will be fine.
Inshallah.
And then you said that you had some pain in the left knee also, which will take. We will investigate later with MRI, and if need be, if you're having pain, we can do that also.
Yes,
So
yes.
all the best for tomorrow. Go home, recover, have dinner, and I've given you all the pre-operative instructions, written as well as verbal. Should not take anything tonight.
After 12.
After
10.
No, after 10.
Water. You told me after 10.
Wife is always more clearer.
You told me food only till to 10 and
water
up to 12.
Yes,
After 12, I cannot take anything.
yes.
Okay, okay, no problem.
And you have to wake up at 3:30 and report to the hospital by 4:30.
Okay, nice. Okay.
Good afternoon. I am Mr. MD Rafiqul Islam. Just 2 days back, I explained before operation, before surgery about my issue, my problem. So after that, I just come here again. So yesterday, 5:30, around 6:30, 6 o'clock, my surgery started. In my problem was the meniscus, lateral and middle meniscus torn, which one is removed, and also stem cell therapy, take my fat and then blood cell platelet together, make a solution and then inject to my knee joint. So after that, I'm little bit tired now, but not that much of uncomfortable. After surgery taken at 12:30 or 1 p.m. I mean, after 3-4 hours later, I just try to walk with a single scratch. Then finally I can. After that, doctor told me to go back to my hotel, and then I left from hospital. In the beginning time, in the evening time, a little bit uncomfortable till sleep, feeling some pain, little bit. But after wake up today morning, I feel much better. I went to kitchen, prepare my coffee and take my coffee to kitchen to dining, and very relaxedly I had it with any of my son and my wife's support. They are maybe still they are sleeping anyway. But now after 12 hours and after 15 hours later, I think much better than before. Hopefully it will be more better in future. So thanks to doctor and thanks to where the operation theater and full of his team, they did a good things for me, and hopefully I'll be which problem I am facing last long, it will be overcome this situation, and I will continue my smooth movement with knee and everything. Regarding patient, which I lastly in my last video I told, I had some problem. When I found this problem, then I went to doctor locally, they found the problem. This happened, but the discussion, the consultancy, actually what the patient want, doctor should be explained in details. Then psychologically patient will make himself or herself is much better or confident to take a decision. So anyway, in this regard, I am little bit confused. Doctors may be okay, but I am not that much of clear. So immediately I moved to Dr. Venkatachalam, as because of he known to us, and last 15 years back he had a good operation, good surgery.
Your relative?
Yeah, with in my relative, in relative. So in this case there is a reference. So immediately come to him and get the consultancy from him. And finally, I decided to do these things. There is a good update technology, which is called stem cell therapy. Stem cell therapy is a totally is a new concept, which is all over the world is upgrading this concept. For me, to prevent for the knee replacement or any other worst case, I had this to consult with the doctor A.K. Venkatachalam. I think this one everybody this is affordable, not that much of costly also, but it can be if it is workable 80%, 60, 70, 80% also, then it can be prevent for next step, that is knee replacement. Because in any case of arthritis, the surface of knee joint, cartilage and others, if going to be rough and the damage portion is much more, then no way to go for any replacement of knee joint or anything. So before knee joint replacement, we can try with this therapy, which is more comfortable and easiest things. Within a 30 minutes to 40 minutes, the solution made in the prepared in the operation theater, which I had already, and inject to the knee joint, and completely hassle free. And actually I'm telling you all that it is completely in my with beyond of my known. Automatically it finished. Doctor once told me, Rafiqul, it is finished now. So I just make me surprised that how did everything done. Anyway, everything done. Hopefully I will be much better movement and everything, regular life in my life, in better future next. Thank you all.